opposite of edema, which is fluid excess, is fluid deficit, dehydration. So dehydration is very simply insufficient body fluid. So it can be caused by inadequate intake of fluids, excessive loss of fluids, or both, some combination of both. Fluid loss is often measured by a change in body weight. So with edema, we said that body weight is often increased. With dehydration, body weight is decreased. So they're pretty polar opposites. Dehydration is more serious in infants and older adults because they don't have a good fluid reserve, and they also lack the ability to conserve fluid quickly. Infants tend to have more insensible losses, like perspiration from the skin, because they have a higher surface area to volume than adults do. And also, babies can't just say, "Oh, I'm thirsty," and go get a drink of water. So there's that. Um, the vascular component is really rapidly affected in an infant, so they can get hypovolemic pretty quickly, and then that affects their major organ systems. It's really dehydration is really serious in an infant, and then in an older person, it can end up causing electrolyte imbalances, which can cause cardiac issues, and so it's a really serious thing in an older person as well. So water loss may be accompanied by loss of electrolytes and proteins, such as when you have diarrhea, and so that can become a serious issue as well. So the major causes of dehydration, or common causes of dehydration, vomiting and diarrhea both result in a loss of electrolytes and nutrients, such as glucose, as well as water. And if you're in the hospital for whatever reason and they have to drain or suction out any portion of your digestive system, it can have the same effect. So just losing that fluid out of your digestive system one way or another. Excessive sweating with loss of sodium and water can cause dehydration. You know, like when you're sweating, if you taste it, it tastes salty. That's our sodium going out there. Diabetic ketoacidosis is you can have loss of fluid, electrolytes, and glucose in the urine. And we'll talk way more about that in chapter 16. Insufficient water intake in older adults or in unconscious persons. So if you're in the ICU, for example, and you're unconscious, they're usually giving you fluids intravenously because you can't drink when you're unconscious. And then older adults, they have the reduced thirst sense, and so a lot of times they're not having enough intake. Use of concentrated formula in infants. So when the formula is concentrated, it absorbs more water, and babies don't have that much fluid reserve anyway, so it's basically sucking the water out of their little bodies, which it's not good. So dehydration decreases the amount of fluid in the interstitial and the intravascular fluids, and the effects that you can see, the manifestations, are dry mucous membranes in the mouth, decreased skin turgor or elasticity. So that's the test where you pinch the back of the hand or pinch underneath the clavicle, and if the skin doesn't bounce back, then that's decreased skin turgor. I remember when I was a freshman in college, and I remember a biology professor saying that if you go out drinking one night and the next morning test your skin turgor, and it's probably poor because of dehydration from the alcohol. I don't remember ever testing it, but I really remember the professor saying that. Low blood pressure, weak pulse, and fatigue. Increased hematocrit. So the hematocrit is the percentage of the blood that is red blood cells. So if you have less fluid, there's going to be a higher percentage of it that's red blood cells. Decreased mental function, confusion, and loss of consciousness. So those are all pretty serious effects. So the manifestations that you'll be able to see or measure in some way, decreased skin turgor and dry mucous membrane, sunken eyes, sunken fontanelle in the infant, Lower blood pressure with a rapid weak pulse, increased hematocrit, increased temperature, decreasing level of consciousness, and low urine volume. And when the urine is low volume and high specific gravity, which that can be measured in the laboratory. But the low volume you can measure in the patient's room or wherever. So the body is going to attempt to compensate for fluid loss by increasing your thirst, increasing your heart rate because we're trying to get less blood volume out, constriction of cutaneous blood vessels to shunt the fluid to the more important areas of the body, and producing less urine by concentrating the urine. So this is the chart in the book that compares edema and dehydration. And I think this is a great chart because you can see how they're pretty night and day opposite of each other. So localized swelling in the feet, hands, periorbital area. So swelling around the eyes versus sunken eyes for dehydration. Different presentation of the skin. Weight gain with edema, weight loss with dehydration and thirst. Slow bounding pulse and high blood pressure with edema. Rapid, weak, thready pulse and low blood pressure with fluid deficit. Also, you could cause orthostatic hypotension, which is when you stand up from a lying down or seated position, your blood pressure drops. And it can make you feel dizzy, which is in the next section, dizziness, fatigue, weakness, dizziness. And with edema, lethargy, and possible seizures, if you have cerebral edema, can cause seizures. Pulmonary congestion, cough, and rales, which is the sound of the fluid moving in the lungs. Increased body temperature for dehydration. And then the laboratory values are like opposites of each other. So decreased hematocrit for edema, increase for fluid deficit. Decreased sodium for edema, increased electrolytes or variable electrolytes for dehydration. Urine, high volume, low specific gravity for edema. For dehydration, low volume, high specific gravity. So they're night and day. And the little note at the bottom, signs may vary depending on the cause of imbalance. Yes. So that's an important thing to know. There's a phenomenon that's called third spacing of fluid, and that's where fluid shifts out of the blood and into a body cavity or tissue where it can't re-enter the vascular component anymore. So it gets where it's not supposed to be, basically. So if you have something with high osmotic pressure in the interstitial fluid, like in burns, and the reason you have high osmotic pressure in burns is because you get tissue damage, and so you have excess proteins in the interstitial fluid. And the damaged tissue in burns doesn't allow it to access the vascular compartment. So the fluid gets stuck out there, basically, where it's not supposed to be. Sometimes when you have increased capillary permeability, particularly from chemical effects or some gram-negative bacterial infections, you can get third spacing because the capillaries are so permeable that the fluid isn't getting taken back up. So fluid gets trapped out into that third space, and that's a serious medical emergency. You need medical intervention to recover from that.